Welcome to the second part of Module 1 on introducing you to project management. This is project management across the life cycle. This part is related to the earlier session and had a passing reference to the project life cycle, which was shown through a video, if you remember. Before we go in to the different phases or the life cycle of a project, it is important to conceptually distinguish this, that is the project uh, life cycle with the different project management processes. The project or study life cycle is the different phases of a study which has a definitive beginning and an end. The phase follows a linear and successive pattern, like one phase being followed by another one. For instance, the study beginning with the conception phase and ending with the dissemination phase. The project management processes, on the other hand, are activities that are undertaken in every phase of a project life cycle. The two are obviously linked to one another, with the project management processes emphasizing on different administrative and operational activities of the project. This distinction is further outlined in the table here, as you can see. If we look at the definition, the project lifecycle is different stages of conducting research, while the management processes are the activities to manage the research project. In terms of the focus, it has a methodological progress. It looks at the progress from a methodological point of view, whereas the management processes looks at operational and administrative control. It is driven, project life cycle is driven by research questions and the methodology, and the management processes are driven by project goals, timelines, and resources. The outcome of the project life cycle is new knowledge or insight, while for the management processes, it is successful delivery of the research project. The example we can give is like for a study, it is the data analysis plan for the study life cycle, while the management process related to that would be managing and storage of data. The research project life cycle broadly covers the following phases, which are shown in this figure. The research idea and development and submission of the proposal can be clubbed into the ideation and planning stage. The seeds of a research study often starts with an idea. This may be a novel idea or an extension of an idea that has already been shown to be effective. The idea then needs to be fleshed out and developed in the form of a proposal. To understand how we apply project management processes across the different life cycle of a study, it would help to revisit each stage of a project life cycle in terms of what is expected or what actually happens. Moreover, we are sure that all of you, either as researchers or program managers, are aware of these different stages. What we want to discuss here are the stages from a project management perspective. A research idea in itself doesn't mean anything if you cannot put that idea into practice. This is the initial stage, in fact, and takes the form of developing, writing, and submitting your proposal on time. During this stage, much of the planning for your study happens, as you are supposed to outline the timelines as per the study objectives and activities. We will not go into the technical part of the proposal, as many of you might have attended a course on proposal writing. However, what is important is that Developing the technical aspect of the proposal requires coordination and collaboration with a team. For instance, a qualitative researcher, a biostat expert, a health economist, etc. Putting together a team of experts and delineating their roles and responsibilities also requires continuous coordination at this phase. The proposal also requires to clearly outline the governance structure of the study at different levels, along with an implementation plan. Depending on the study being a single or a multi-site study and the setting and the population, this requires collaborating and coordinating with research institutes, NGOs, CBOs, hospitals, as much of the study in the NIHR is multicentric, so you might be multi-site, multi-country, so you might be aware of this aspect. And the financial part of the proposal will require working with potential partners if you are collaborating with any, and your finance colleagues. At the end, having a research manager to support at this stage is very critical, as there are certain official requirements and paperwork from funders, especially from government funders. The next phase is the award notice and the project startup. After we get the good news of the project being awarded and the funds being received to start the study, those aspects that were in the proposal need to be converted into activities and need to be put in place for the next step of project implementation. So having manpower and infrastructure in place, for instance, uh, to first recruit researchers and managers who will run the show. For large-scale community studies, setting up a functional field office from where the project operations will take place till the study is completed. Identifying and engaging with key community stakeholders. The permissions need to be taken from various departments as per project requirements. Ethics approval and registering the study before participants are recruited. For the project to run smoothly in the subsequent phases, a communication plan and a monitoring and documentation system should be in place. Some projects may have a number of committees to be convened and managed. For example, the steering committee, the data safety monitoring committee, and others. Then data management systems should be set up as per institutional policies and procedures. At this stage, it is sensible to revisit the project timelines, assess risk, and have a mitigation plan. Much of the planning that went into the proposal development stage aligns with this startup stage, and in fact will guide this stage to implement activities in the next stage. The next stage involves the actual implementation of project activities. If the project involves intervention, development, and adaptation, then, like most of you mentioned last time who were involved in formative research, is required for this. This will include recruiting field staff, finding the appropriate formative site, setting and involving the participants in your formative research. Studies that involve rolling out complex interventions must adhere to managing standard operating procedures. This will require coordinating within the team and with multiple vendors, if any, who are involved in implementing the intervention. Project activities needs to be closely monitored and implementation gaps identified in real time and addressed accordingly. As per planning in the startup phase, managing timely start and end of data collection along with monitoring for data integrity and quality is critical. Budget management involves the process of tracking income and expenditure during the project life cycle. This task is delegated to the project manager or the project lead, who will be responsible to check expenses against the budget each month. The final phase is the project closeout phase. This stage starts at the end of the implementation stage to bring out a close to the uh, uh, to bring the project to a close. At the end of the project, all files and documents, either paper or and electronic, must be archived for a specific period as per the project protocol. All files should be filed securely, but should be accessible as they are needed when they need to be referred to. Setting up documentation strategies in the startup phase will help putting together experiences distilled from the project that could assist on similar studies or events or scenarios in the future. The statistics and project team will be involved in the preparation of the primary manuscript, while the communication team can provide input and assistance for the dissemination of the study results. So having completed the different stages of the project lifecycle, let us jump into the project management processes. As we have mentioned earlier, the project management processes involve administrative and operational activities undertaken in every phase of a project lifecycle. This is an iterative process and is described here in the figure. If you look at the figure, there is an initiation which leads to planning, which leads to execution, which then leads to monitoring and controlling, which again feeds into the planning phase. Therefore, it is an iterative phase. And then there is a closing. So one of the groups last time had used this framework to make their presentations. So I hope they will be able to relate to this more. So the initiation phase is define the activity and set up expectations, define the purpose, scope, and objectives of your activity. The planning phase involves developing a detailed plan with schedule, task, a communication plan, resources, and budget. It is good to identify and address potential risk at this planning phase. The execution phase involves putting the project plan into action, managing resources, and carrying out defined activities. Build workflows and assign tasks to team members would be of great help. The monitoring and controlling phase involves you make sure that the execution is in line with your plan. You track progress, manage risk, and make necessary adjustments to the plan as needed. It also includes ensuring the activities meet quality standards. The closing phase is reach goal and complete all deliverables, discuss failures and successes, and document lessons learned. The project management life cycle can also be seen like this. It also can be seen as something which is cyclical in nature. Uh, the initiation, I like the way this is put. The initiation is starting an amazing journey. The planning is putting all of that, your learnings together to plan the activity. Execution is making it happen. Closing is you've achieved your goal. And monitoring is you keep hunting for improvements in all these phases. Now, I would like to give you an example of how the different project management processes are used in the project life cycle in the stage, rather in the activity of the project life cycle stage. That is in the ideation and the writing up of the proposal. So how do you develop a proposal? So the initiation, the purpose of this is so that it helps you for your home assignments. So if you remember the project management processes, the different phases of the project management processes. So the initiation phase is where the purpose of this activity is to develop a research proposal on, for example, improving resilience among older adolescents in urban slums in India. After writing up the proposal, it is expected to submit it well before the deadline. The planning phase will involve a lot of planning. Again, I'm reiterating this fact that planning is really very crucial. So I'll try and quickly just go through this. So reaching out and working with other possible COIs and PIs, coordinating with other experts who can engage in the project as partners, collaborators, putting together a project team, which will include COIs, co-PIs and COIs, and stating clearly each individual's roles and responsibilities, reaching out to potential committee members like the steering committee, DSMB members, international experts. If you want to have a participant advisory group, like an adolescent expert advisory group, getting inputs from participants themselves that may go in as a video with the proposal, reviewing literature specific to the proposed topic, getting basic socio-demographic information on the population and the setting, which goes into developing your proposal, coordinating with other sites, hospitals, etc., and completing the financial part with your finance colleagues, writing the first draft by 15 days, sending it to all seeking feedback by the next 15 days, having the final draft read by a month and getting it reviewed internally or externally in the next 15 days, having the final proposal ready to submit by the third month. So I'm keeping a target of 3 months to finish writing this proposal, a range of official documents and complete paperwork for final submission. To continue, the execution would be in terms of, what are the tasks, who's the person responsible, and what is the timeline. So meeting with co-PIs and co-Is, so the lead and co-lead will do in 2 to 3 weeks. You can go through this. I'll give you a few seconds to go through this, like naming of committee members, reviewing literature where co-Is and other researchers can help. They will take 2 weeks to do that. Then proposal for the first draft of the financial of the financial part. Like you're aware that a proposal has two parts, a technical part and a financial part. So who takes responsibility for that and what time? Uh, and then, at the end, official documents for submission. The lead and the research manager can do that, which would take 2 weeks. And then the final submission, the lead and the research manager does that 1 week before the deadline. It is always wise to submit much before the final deadline, because there might be technical glitches and all your hard work might go to waste. The monitoring would be progress of all tasks against timelines will be monitored by conducting weekly meetings among the co-PIs. Other experts, partners, and collaborators will be invited to join these meetings as and when needed. Corrective measures or modifications to the proposal will be taken or done after the team reaches a consensus in the weekly meetings. Closing would be, we will close this activity once submission of the proposal is made and there is official acknowledgement by the funders. The submission document will be retained. Lessons learned during the process of developing and writing the proposal will be documented.